At 3 to 6 months is peak shedding phase, where you can lose up to 300 hairs a day. You've just had your baby, and now, months later, you notice your hair falling out in clumps. You're already dealing with sleepless nights and new routines, and now your hair's falling out. This is what's known as postpartum hair loss. Postpartum hair loss is a specific type of hair loss. It's completely normal. And it's not the same as androgenetic alopecia, which is where you're actually going bald. In this video, we'll walk you through how long postpartum shedding lasts, why it happens, and the treatments we use here at DSI that can help your hair recover faster. I'm Dr. Lauren Boshnick, a board-certified dermatologist here who specializes in hair restoration. Located in the Chicago area, our team has helped thousands of women address hair loss of all different kinds, from early prevention to advanced restoration. During pregnancy, your hormones, especially estrogen, are at their peak. Estrogen keeps your hair in the growth anagen phase longer, which is why so many women enjoy thicker, fuller, more radiant hair while pregnant. After giving birth, estrogen levels drop rapidly, and a large number of those hairs shift into the shedding or telogen phase all at once. This condition is called telogen effluvium, and that's the reason for the sudden shedding many new moms experience around 2 to 4 months postpartum. In the normal hair growth cycle, some of your hairs will be in both the anagen and telogen phase. However, when you're pregnant, you have more hairs in the anagen phase. Thus, after pregnancy, you'll have more hairs in the telogen phase. Hence, the clumps of hair falling out that is very common and completely normal. For most women, postpartum shedding begins around 8 to 16 weeks after delivery and typically lasts 3 to 6 months, but can last up to 12 months. At 0 to 3 months, hormones are shifting and shedding begins. At 3 to 6 months is peak shedding phase, where you can lose up to 300 hairs a day. At 6 to 9 months, things start to slow down and regrowth can begin. At 9 to 12 months, most women have recovered. By your baby's first birthday, your shedding should have stabilized and new regrowth should be noticeable. After 12 months, if you're still having shedding, that's when you may have a more serious hair loss condition that requires a professional evaluation and more specialized treatment. Here at DSI, we can help identify whether your hair loss is still within the normal postpartum phase or if it's evolving into something else, such as androgenetic alopecia or female pattern hair loss, or a chronic telogen effluvium. While temporary shedding is normal, you should schedule an evaluation if you notice any of the following: hair loss lasting longer than 9 to 12 months postpartum, the thinning is primarily at the crown or the central part of your scalp, that your scalp is really much more visible under light, or if you have a family history of hair loss, sudden patchy bald spots. Any of these could indicate another underlying cause. An early diagnosis is key to effective treatment. DSI's approach to postpartum hair loss: we take a medical and holistic approach to postpartum hair recovery. Our evaluation includes a review of your hormone balance, scalp health, and overall follicle vitality to best determine the combination of therapies that will work for you. Postpartum hair loss is totally normal. You can certainly let it run its course for 6 to 9 to 12 months and let things get back on track naturally. Or if it's bothering you and you don't want to wait, there are ways that we can treat it temporarily. Here's what we typically recommend. Topical or oral minoxidil. Minoxidil is a vasodilator, so it increases blood flow to your hair follicles, prolonging the growth phase and stimulating regrowth. It's proven to help regrow hair, but it's important to remember that minoxidil, as it pushes follicles to start the hair growth cycle over, may enter a shedding phase before entering that regrowth phase. Shedding may continue for 1 to 2 months after starting minoxidil. Talk with a professional provider or your doctor to make sure you're medically cleared to take minoxidil, especially if you're breastfeeding. You should not be taking oral minoxidil if you're breastfeeding, only topical. If you're using topical minoxidil post-pregnancy, it's important to wash your hands before touching your newborn, as they can develop unanticipated hair growth in the areas that you touch. PRP, or plasma-rich platelet injections, use your own platelets and growth factors to re-energize dormant hair follicles by extracting some of your blood and separating those platelets from the other blood components. We then inject those platelets into the scalp. It's safe, natural, and ideal for women seeking non-hormonal treatments to encourage thicker regrowth post-shedding. There is scientific evidence that shows low-level laser therapy can increase circulation and stimulate follicles without medication. This is perfect for postpartum patients who want a gentle, non-invasive solution. We recommend a device like the Revion Red Cap, which we offer here at DSI, both for you to take home as your own device to use whenever you need, or if you're looking for a more affordable option, you can schedule an appointment to use one that we have at our office. If you do have Telogen Effluvium, it might not make sense to purchase an expensive device for something that typically does resolve in 12 months. That's where coming to visit for in-office treatments might work better for you. Postpartum hair loss can be worsened by iron, vitamin D, protein, or other nutrient deficiencies. It's extremely important to eat well and have a healthy diet after pregnancy. Here at DSI, we review your nutrition and recommend medical-grade supplements that support healthy hair and regrowth while being safe for postpartum recovery. Sleep deprivation and cortisol spikes can contribute to ongoing shedding. It's important to manage and minimize stress and get plenty of rest, which we know is hard with a newborn. But doing your best to reduce stress and relax can help to mitigate some of that postpartum shedding. It's probably time to schedule a consultation if your hair loss continues beyond 9 to 12 months or you notice visible scalp areas. If your ponytail looks thinner, there's a significant amount of anxiety or self-consciousness about your hair. DSI's message to new moms. Again, postpartum hair loss is normal, temporary, and treatable, but that doesn't make it any less stressful. We're here to reassure and support you through every stage of your recovery. With the right care and patience, your hair will return, often stronger and healthier than before. Most postpartum hair loss resolves naturally within 6 to 12 months, but if you're worried, seeing a specialist early can help speed up recovery and rule out other causes. At DSI Hair Restoration, we use advanced diagnostics and proven treatments to help you regain your confidence, your hair, and your peace of mind. If you have found this video helpful, please like, share, and subscribe, and book your consultation to learn how we can help you recover your hair health post-pregnancy. We'll see you in the next one.